Do you know what a non-traditional career is? A non-traditional career is any one in which a single gender represents less than 25% of the total number of workers. There are non-traditional careers for both men and women. Here are some examples, though this is not an exhaustive list. Women are underrepresented in engineering, auto mechanics, electricians, computer scientists, law enforcement, heating, ventilation, and air conditioning, fire management, construction management, culinary arts, and welding. Men are underrepresented in massage therapy, nursing, early childhood education, cosmetology, dental hygienists, and bookkeeping. One of the root causes for why people don't pursue and persist in non traditional pathways is a lack of role models. This is related to self efficacy, the belief one has in their ability to complete a task. One of the sources of self efficacy is vicarious experiences or the observation of models. Seeing someone perform a task or meeting someone who looks like them, who's in a career or pathway, can over time increase someone's belief that they can do a task and increase a sense of belonging. In this series, I interview people who have pursued careers in non traditional pathways. I hope that you will be inspired by their stories. Lance, welcome. Thank you so much for joining me today to talk about your career in nursing. So, our goal is to increase awareness of people who have pursued and entered into non traditional careers and pathways like men in nursing. And I'm really grateful that you have volunteered to talk to me today. So, start us off. Tell me a little bit about yourself and your career as a nurse.
So, um, so I'm Lance. I was born here in Southern California. Graduated nursing back last year, May of 2020. Took the NCLEX in July of 2020, and then got hired in October. And so since October, I've been working as a new graduate nurse.
So, what has it been like working as a nurse in a global pandemic starting off in your career?
Very challenging. It was a tough adjustment. Um, Fortunately for me, I wasn't like on the COVID unit, but you can really see the impact of like how one unit can like affect the other, the entire hospital, right? Getting more critical patients and all that. But it was a tough adjustment, but you learn to get through it.
What are some of the top three things that you've learned in, I don't know, 6 months or so into your career?
Um, Three things. So first off, like nursing is, it's not just like within the past 6 months that I learned about all about this, but like being in nursing school. Like one thing for sure that I've learned is that nursing is not just like a physical thing. Like it's not just there's also more aspects to healthcare besides like treating the physical. There's psychosocial, there's like support systems and the spiritual and this and that. And so it's a very holistic way of looking at healthcare and taking care of people, not just not just like, oh, you have this disease, we're treating this, but we also have to treat the mental and psychosocial part of it as well. um you know Second off, like being there for people who are in their like most vulnerable, like one of their most vulnerable times in their life. It's very scary to be in the hospital, and that can be anxiety inducing. Just managing to be a support system for them and their families as well. And then three, like being a communicator, being an advocate for your patient. Communicating what your patient wants to the doctor, communicating what your patient wants with other like disciplines within healthcare, with dietitians, with social workers, and so on and so forth. So it's um, it's been very, I hope that answers the question. I'm not like too sure, but
Oh, I think it's great.
okay.
So, were all of those components that you listed, was that part of your training in a nursing program, or were those things that you got to the job and you're like, wow, like this is really critical and I need to
No, no,
learn?
Yeah, it's all part of training, and in the end, like, you practice like communicating with your fellow nursing students, and you practice communicating with your nursing instructor and nursing professors, and then also you practice communicating like when you transition into new grad to the new grad program, and then like they always teach us at least at our school, that you treat the patient as a whole, right? You treat all aspects. You treat their social, you treat their psyche, their physical, and all spiritual as well. And you're there like for your entire 12 hours in your shift. Like you're there for your patients, because the doctor's not there for the entire 12 hours, right? The dietitian's not there for the entire 12 hours. It's the nurse and the nursing staff. So
I'm thinking a lot of physicians could use that same training to treat people as holistic
yeah,
individuals.
but yeah, doctors have a lot of on their plate too. So not be like you can always call the doctor for orders and everything like that. But like they're only there for to discuss the plan, discuss the plan of care and what they think is the you know best best treatment for the patient. They're always thinking about their patient as well. Just because they're not there for 12 hours doesn't mean that they don't care. They do care. So, but the nurses are there for the entire 12-hour shift. Yeah.
So describe to me, Lance, what's a typical shift like?
Typical shift for me. So pretty much at the beginning of our shift, we have a huddle or a meeting. We go through like any changes in policy, any changes, what the patient acuity is, what patients are coming in, how many admissions are we expecting to get throughout the night, and then what discharges do we have, if there's any sitter cases. Sitter cases, sitters are pretty much like people who are designated to be with the patient at all times. Sometimes patient can be a harm to themselves, and so we have a sitter for them, instead of like putting them in restraints, which is more restricting. Um, and then like if there's like any isolation precautions, um, so we would go over that in huddle. And then after huddle, we receive report from the previous nurse. Um, any updates, what the plan is for the patient, what's normal for the patient, and so on and so forth. And then for me, I like to look at the orders first, the doctor's orders first, because the patient, the patient could probably be eating, but when they really shouldn't, when the doctor doesn't want them to eat because they have like maybe a procedure the following day or a procedure in the next 8 hours. So I look at the orders, I look at what medications are due, and I also look at the lab results, because sometimes there are certain, like, there are medications that you can't give with when the patient has like a certain lab result, or there's certain medications you can't give if like the vitals are, if the patient's vital signs are not within parameters or within the limits of giving. And then after that, after looking at the orders and what medications coming in, I assess my patient, I introduce myself. This is all during, when I introduce myself, I actually introduce myself during a shift change when I receive reports. So that's when I introduce myself to my patient, make my face familiar, give them a quick rundown of what's going to happen throughout the shift. And then once I do that, once I look at the orders, once I introduce myself, I go ahead and then do my assessment. I do my assessment, head to toe assessment, making sure that everything's like within the patient's normal. And then once that is done, I see what needs to be done, what's the next task to be done. And so usually around like 8 or 9 o'clock, I'm passing medications already. And then after that, I see if, um, after that, it's just constant, you know, assessment, reassessing, and then making sure that my interventions are going as planned. Usually, like a lot of things, the one thing that a lot of patients complain about is pain, and so we're constantly assessing for pain, what pain interventions that we can do, and then like reassessing if that intervention worked or not. So giving heat packs, ice packs, pain medication, and it's always assess what's the always assess the patient first, then seeing what is the problem, um, see what your goals are, trying to implement like an intervention, and then evaluate if that intervention works. So that's typically what I do during my shift. I'm very new to this. I'm pretty sure like more senior nurses or more experienced nurses have a better workflow. But this is what's working for me right now.
Great, thanks.
Mm-hmm.
So I want to ask you a few different kinds of questions. So talk to me a little bit about how you have set goals over the course of your pursuit of becoming a nurse. So in your studies, or within the time that you've been working at the hospital, and how you sort of juggled that with failure. I like to talk about these two in the same conversation because I think that they often go hand in hand. So goals and
Mm-hmm.
failures. Tell me a little bit about your process in setting them and managing when you don't reach them.
So pretty much like before like going to college and going to nursing school, there for me at least, I always have like a long-term goal and a short-term goal. So before going to college, my short-term goal was to get into the nursing program at our school. The long-term goal was to graduate and to pass the NCLEX. The NCLEX is a test that we take, that nurses take in order to get their license. So short-term goal-wise, it just helps me to like figure out the steps that I need to take in order to reach that long-term goal. So when I was going to nursing school or before nursing school, my goal was to get into the program. And so it helped me think, oh, what I need to do in order to get into the program. So I had to do well in my classes. I had to, study, anatomy and physiology, microbiology, chemistry, and all that kind of stuff. And not only the sciences, but also do well in like English and history and my general education classes, because in the end I think that the GPA helps boost your the GPA helps to make your name pop out to the people evaluating you and accepting you, the administrators. So I thought it was very important for me to figure out, okay, my short-term goal is this. What steps do I need to take in order to achieve that? Because long-term goal to me, I feel like it can always change. It can change because you're not there yet. Like long-term goal can be like in 4 years, 5 years, maybe it could be also in a month. But yeah, for me, setting up my short-term goal first, reaching that, and then thinking of what's the next short-term goal, and then if life happens and goals can change as well. In relation to failure, failure can end up changing the goal or changing the plan to what I wanted. Like for example, you always, like for me, At our school, passing is 75%. 75%, which is a C, right? So for us, it was like difficult. It was like a hard pill to swallow if we failed by like point one, like 74.9, or like 74% or 73%. And so that kind of like changes what steps we take in order to study, changes our study habits. And I don't know if that answered that question. I think obviously, like when you fail, you learn what works for you and what doesn't work. And, you just have to learn from your own experience. And like talking to patients, sometimes the way you talk can be, it can come off as, how do I say it? It can come off as like rude, but like, that's normally how you talk, right? But you learn from that failure to communicate better, to try to, you try to look past your failure, I guess. I hope I answered that question.
Yeah, I mean the point that I got from what you're saying, and what I hope when I ask that question, is that setting goals is really important, right? Whether they're short term, like get into school, graduate from school, but also like you set lots of goals within that goal, right? Like pass
Yeah.
this course, pass this project. So you have lots and lots of goals along the way. And if you don't get the goal that you want, you learn from that, right? Like so you're talking about
definitely.
Even in your practice at the hospital, if a patient who is like on their most vulnerable day, right? Like if they perceive your tone to be rude, as you said, like you just reset and you figure out, how can I be better next time? How can I better serve that person? And so it doesn't mean you quit. It just means you reset, reboot, and try something different. Imagine in your field, failure could be perceived as a really bad thing when it comes to patients, but it's such a human part. And failure doesn't necessarily mean loss of care. It just means, as you talked about, helping the patient to manage their whole self, and that there's a lot of opportunity for growth, and every person's different. And so you're learning to operate with so many different people. That is really challenging. So my next question is about role models, or people who you knew that you looked up to. So did you know any men who were in nursing before you chose the pathway?
Maybe like two. I think one of my mom's friends, her son is a nurse. And then my cousin is also my cousin's husband is also a nurse as well. So not really like influences for me, because at the time, like I didn't really know too much about what a nurse is. And this was like when I was like in middle school, and we really, in our family, really don't have like a lot of men who are nurses. Contrary, like for me, my influence is my mom, because she's like the breadwinner in our house. She's not a nurse, but like she's the breadwinner in our house, and um, she's the one like helping us out and doing this and that, and our dad helps around too, but mainly like my mom has been my influence. She's a clinical laboratory scientist. She does like all the testing, and in the hospital, like whenever a blood sample is taken from a patient, she does all of that. And so like to me, I felt that my mom, being the breadwinner in the house, she was she was like an important influence to me. She's she's doing things that no other person can do, and trying to I really had no like very little influence about of like men in nursing. So
Well, so it sounds like because your mom, even though she's not a nurse, she was still in healthcare. Maybe that
hmm
was still sort of, an influence. Parents are really influential in what their kids believe that they can do and want to do. So that's great.
hmm
Um, Now, as you're working, have you found any role models, men or women? And how are you nurturing those relationships and being mentored by someone?
hmm yeah. So when we're first working, we work with a preceptor. They basically teach us the ropes of what's like a good routine for them, and then you try to apply that to your own practice. And so I've had many preceptors within my 6 months, like especially within the first month of training. And then after that, I always look up to my colleagues who, they have like 30 or 40 years of experience, and I'm just here with my 6 months of experience. And so I always look up to them, like men or women. And then uh, I always ask them for help. I ask them like it's better to ask than to do something that you don't know and then it results in something really bad. So I always ask my coworkers, my colleagues, like, hey, how do I do this? Am I doing this right? How can I be better? And because ultimately your goal is to have like the best patient outcomes. So I always look at like regardless of gender, like I always look at everyone with the most experience as a good role model for me. Um, and then I also look at like not just the nurses but also the nursing aides because they also have a lot of experience and I also have a lot of things to learn from them as well. Um, mhm,
Great. So, one of my last questions is I've got two left. So, tell me about how and what way you've faced any sort of gender stereotypes and how have you managed those? How have you sort of overcome them? Just talk a little bit about stereotypes.
mhm. Um, I guess the one stereotype with my profession is that nursing is for women, right? Um, Never really encountered that too much, but on some occasions I do. And then, like during college, I have a few friends asking like, "Oh, what's your major? What are you studying in?" And I said nursing, and said, "Isn't that like for women?" And it it kind of like makes me like laugh to myself because in our program there's only like 10 men out of like a class of 90, but
That's about average.
but to me like it just became normal to me. Like I never like thought about it that way. um I don't know, I just to me like just it doesn't matter what they say, like, oh, nursing is for women, like it doesn't matter to me. Like you're there for your patients, you're not there for your you know you're not there because, oh, I want to go into nursing. I don't know, like um scratch that, hold on. Like you're in nursing not because of your gender. You're there because you want to help people out and you want to support people in their most vulnerable state. So that's how I see it. That's how most of my friends see it. That's how most of my classmates see it. So
Great. That's
yeah.
beautiful. Okay. So, last
hmm
question is so, what advice would you offer to any any other man who is considering going into nursing and then combine that with what you love about it? So, advice for anyone, for any man who's considering nursing as a career and why you think it was a great choice for you.
hmm yeah, don't be intimidated by the like don't be intimidated that there's probably gonna be like a 10 guys in the class of 90, like don't be intimidated by that, because if you let that intimidate you, then who knows, right? It's just, it can be scary, right? It can be scary to be like the 1% in a class of 90, or not the 1%, the 10% in a class of 90. Like, it can be odd at first, odd at first. But like, if you don't let it intimidate you, like, it's just a normal, just a normal college lecture, normal class. um you know it's it's definitely that, it does definitely, like, if you don't think about it, then it's not weird, right? If you don't think about it, it's not weird. If you think it's weird, then it's going to be weird. I that's how I can best explain it. And then what I love about it is that, you're just there. You're just there to, you're just there to help. You're just there to, be there for others. It's a very selfless profession, in combination with, you know, knowing the sciences, knowing the social aspect, knowing, knowing the mental aspect. So just think about it as holistically as possible, and you'll get there. You'll be like the best nurse as you can be.
Lance, thank you so much for your time today and for offering your expertise. And it's so important that that we present more role models so that people can see themselves in those careers. And so I'm grateful for you sharing your experience. I love your perspective being fresh out of school. I think that that's really unique and offers unique value to anyone who's considering it, because you can kind of see what's it like right out of the chute. And so again, thank you. Any